use the GI tract if possible. A person experiencing severe metabolic stress is most likely to experience malabsorption of nutrients. They would not have a decrease in metabolism, they'd have an increase. And they'd definitely have an increase in cortisol too. That's your stress hormone. Person needing tube feeding but has some mild digestive problems should be given a hydrolyzed formula. Remember the different types of formulas? Hydrolyzed is something that's easy to digest. It's already partially broken down with them. Which of the following would be found in an intravenous solution? You're not going to have whole protein in there. Don't forget, everything has to be in absorbable units. There's no absorption taking place. So the protein would be in the form of amino acids. Starch, you're not going to have. You have the glucose in there. Dextrose, by the way, is the clinical word for glucose, in case you guys don't know that. And usually they eliminate vitamin K and iron, and they give that individually. Best tube feeding placement for a person needing short-term feeding who doesn't have risk factors for aspiration would be a nasogastric tube. That's the quickest, easiest one to insert, but not a good idea for people with aspiration risk. During the inflammatory response, blood levels of iron tends to decrease. What else decreases? There's 3 things that decrease with inflammation. What are they? Iron, zinc, and albumin. After a severe burn, person has very high needs for all the following except fat. Very high needs for protein. Vitamin C is needed to manufacture collagen in your skin. Protein obviously is needed to make body tissue as well to repair that. And dehydration is very realistic. They got to have a lot of fluids too. People experiencing severe metabolic stress as a result of an accident, injury, or surgery are often given supplements of arginine and glutamine. I just mentioned that. Which of the following side effects is likely to occur as a result of parental nutrition? Let me tell you guys right off the bat here, there's a matching section on your test. But list the complications. And you've got to indicate whether or not it's a complication from tube feeding or parental nutrition. If it's anything that involves poop, diarrhea, constipation, if it's anything like that, then obviously there's food in your GI tract. So it'd always be tube feeding. If it's vomiting, aspiration, that means there's food in your GI tract. So anything that involves organs is usually parental nutrition. Okay, there's one more here. Let's do module 8. Steatorrhea can cause all of the following except weight gain. You're going to have a lot of weight loss with this malabsorption. A person suffering from irritable bowel syndrome should be encouraged to avoid all of those. Milk can cause issues, alcohol, caffeine, all stomach irritants or intestinal irritants, by the way. The main dietary advice for someone with diverticular disease is to avoid constipation. I just told you that. It'll be on your test. A person who reduces their stomach acid significantly by using antacids is likely to develop a deficiency of iron. Why? Anybody know why? Because you need acid in your stomach to absorb iron. Recommended diet therapy after stomach surgery includes eating small, frequent meals and snacks. A requirement for home nutrition support includes needing long-term therapy. I will tell you guys, there's a question on your test. Which of the following persons would be a good candidate for home nutrition support? Trust me, they're not going to go through hours of training. It's a lot of training for this. They're not going to go through all that to be too fed at home for a week. It's going to be for people needing long-term support usually. The most common cause of foodborne illness is improper food handling. I just mentioned that. Which of the following is not likely to cause tooth decay? Remember, you're looking at carbohydrate, in particular sugar. Vitamin C, by the way, is an acid. So if you're chewing vitamin C supplements, that can actually cause tooth decay. Real quick review on dental, because I wasn't here for that. She did go over that dental health case study with you. Yeah. Which nutrients are most critical for your teeth? I'm sure there's a question on your test about this.
Calcium, magnesium.
Calcium, definitely. Fluoride, don't forget about fluoride. Magnesium is very important. Those are probably the most important ones, but there's actually quite a few. Those are the most important. Vitamin C is most important in preventing gum disease, by the way. A person experiencing steatorrhea is often prescribed supplements of MCT oil. I mentioned that several times today. Steatorrhea means they're having fat malabsorption, so they need a type of fat that's very easily absorbed. Which of the following food items is not likely to aggravate gastroesophageal reflux disease? That would be juice. All the other things on there actually weaken that gastroesophageal sphincter and can cause food to come back up into the esophagus. BRAT diet has been around for years and is encouraged to help control diarrhea. What does BRAT stand for? I mentioned this today. Bananas, rice, applesauce, and toast. Pancreatitis often results in diabetes because you lose your ability to manufacture insulin in most cases. Hot foods in a buffet should always be kept above 140 degrees. Remember the danger zone, 40 to 140. So if you go to a buffet, make sure the cold stuff is cold, meaning it should be below 40 degrees, and the hot stuff should always be kept above 140. A person who recently had a colostomy should be encouraged to increase their fluids so they don't get dehydrated. A person with celiac disease should avoid wheat, barley, and rye. Person suffering from short bowel syndrome should decrease their intake of fat. That is it.